She asked me to appear on the medical segment. So about today.
You're a TV doctor? This is what she was opening when she had her attack.
She does have a boyfriend.
Love letters, porn.
Nasty kind. Torture, rape.
This is all that's left. One box in the bottom of the closet. Used to wear those stupid things all the time.
Made in the People's Republic of Lead Paint.
That country has a ring to it, although I might delay trying to get a passport there. I've reacted to 161 episodes of House. This is episode 162. I don't know if I'm going to be able to finish reacting to all of them. It's season 8, episode 7, Dead and Buried. I'm going to see if I can get the diagnosis before House does. I don't have a good track record, but let's see if I can.
Patient had an idiopathic anaphylactic reaction. It stumped 2 ER docs and an immunologist fax.
4-year-old boy, consistently at death's door.
This patient died 5 years ago.
Didn't say which side of the door he was on.
Hereditary angioedema or systemic mastocytosis could mimic anaphylaxis. Elevated BP, what about pheochromocytoma?
Or an anaphylactoid reaction which could be triggered by certain opioids.
We'll check catecholamines for pheo and run an expanded opioid panel. You see what the patient says about drug use.
I just take vitamin C sometimes.
Certain drugs could explain her reaction.
For the past few months, I've been giving something to relax her, diazepam.
Or it's something else.
You have a dead patient?
I don't see creed, color, pulse. 4-year-old kid. His kidneys died, they transfused, his lungs died, he died. Damn! I just realized I'm late for my anger management class. They missed your son's rash.
He didn't have a rash.
I need to examine your son.
You're a bit late for that.
We can get an exhumation order. People need answers.
He's in a crypt at St. Jude Cemetery.
My arms. I can't feel my arms.
I'd like to inquire as to exactly what procedure you intend to perform on the remains.
I think they got the cause of death wrong.
I prepared the sarcophagus for you.
She is pregnant. Test came back positive.
Test for HIV, do an MRI to rule out tumors.
Oh, not much to see here, just the second exhumed corpse during the House series and a pregnant 14-year-old. If she needed diazepam before, then what now? We actually have another double case episode to solve here, but one gets pulse privilege, so let's start there. 14-year-old girl, seemingly anaphylactic reaction, pregnant and lost the use of her arms. She insisted she hasn't had sex though, so what's happening here? Being optimistic with these episodes has never served me well historically, but what if she actually hasn't had sex and the test is a false positive? It could potentially happen with a spinal cord tumour that is releasing the HCG that's detected by the blood pregnancy test that also could have caused the breathing difficulties that were misdiagnosed as an anaphylactic reaction, which then resolved with steroids that reduced the size of the tumour. Now she's getting symptoms again because it's grown, potentially causing the arm paralysis. That can happen with specific types of tumours called germ cell tumours. I'm going for that as my first diagnostic guess of the living. Moving away from the material realm, what happened to the 4-year-old boy with kidney failure that came on over a year, had a transfusion, developed lung issues, and then didn't make it? Kidneys and lungs sound autoimmune primarily in origin, like vasculitis, but it must have been a particularly aggressive type to cause organ failure so quickly. Interestingly, House was looking at the fingers, but if they looked in the nose, they maybe could have found some polyps that could be a sign of eosinophilic granulomatosis with polyangiitis, formerly known as Churg-Strauss. That could fit pretty well here. All right, I'm going for eosinophilic granulomatosis with polyangiitis for my first diagnostic guess. Let's get more clues.
Blood work was negative for HIV. All the money's on tumor. No tumor either. It's not her brain.
Vitamin K deficiency or scurvy could explain bleeding problems, and pregnancy could exacerbate it.
There are Mees lines in his fingernails, so now I'm thinking heavy metal poisoning. Hey, did you know your ex-wife still lives right behind this place? Some kinds of pressure-treated wood can contain arsenic.
How do you look?
Peaceful.
I met a TV producer at a dinner. She asked me to appear on the medical segment. So about today.
You're a TV doctor? This is what she was opening when she had her attack.
She does have a boyfriend.
Love letters, porn.
Nasty kind. Torture, rape.
This is all that's left. One box in the bottom of the closet. Used to wear those stupid things all the time.
Made in the People's Republic of Lead Paint.
That country has a ring to it, although I might delay trying to get a passport there. It reminds me of the story of this 20-year-old guy who found a plot of land between, I believe it was Serbia and Croatia. He called it then the Free Republic of Verdis claimed it for himself and started accepting passport applications. What a legend. We need to find out what's wrong with our living patient though if she'll get her passport out of the hospital. So what are the clues that we have? Well, she started out with anaphylaxis, breathing difficulties, clearly not, she's pregnant, breathing difficulties, arm numbness, a positive pregnancy test, and now some random bruising. They've also confirmed a boyfriend in the picture and some unsavory adult content in the drawer. The episode title is Dead and Buried. Is it a play on words? Maybe the dead relates to case 2 and the buried is the 14-year-old girl's case. What would have been buried? An old parasite perhaps? What parasite could cause all of these symptoms though? That's a tough one, as parasites don't usually cause that constellation of symptoms. I guess if the breathing problem was initiated through the nerves, then it could potentially be discounted as direct lung involvement, which would narrow down the type of parasite it could be. I suppose Trichinella spiralis may be on the cards here, as it can cause nerve and blood vessel involvement, and in theory the antibodies could cross-react with the pregnancy test, causing false positives. Alright, I'm going for Trichinella infection as my second diagnostic guess in the first living patient. Don't really have many more clues on our underground patient except the lines on the fingernails. They are known to happen in kidney failure though, even without heavy metal poisoning, so I'm not sure what they would add here. They could be a sign of something else. Yeah, I have no idea. Let's get more clues.
I met him at school. He was the only boy that liked me. We haven't had sex.
Oh, what else don't I know?
He came here last night and he told me I should leave. He got mad.
He hit you?
What is it?
It's getting hard to see.
How did your ex-wife do it?
She treated it like it never happened. She never even cried.
Halfway through the perimetry exam, her tunnel vision went away.
TIA.
But her new fake nooks stick out like nuts on a mutt.
So you just wanted to look pretty on TV?
Question is, why did he want that? He found out where your boyfriend lives. When I paid him a visit, he took off, ran in front of a car. How do you know I'm lying?
'Cause I'm right here, you dick.
Iris has dissociative identity disorder.
You may not be aware of half the things you've done. Diazepam was masking it.
That's what those vitamin pills were.
Different alters can have different apparent symptoms. We won't know what until we access her alters and compare their symptoms. Hypnosis.
Dr. James Wilson, county coroner. I'd like to ask you about your grandson, Drew Lemaine.
I told you to leave him alone, you son of a bitch.
Temper trigger.
You remember being hurt?
I remember everything.
Baby, it's going to be okay.
It was my fault that he died.
It wasn't a miscarriage. Test shows she's still pregnant.
I'm not seeing an embryo anyway.
Oh, could my optimism about her not actually having had sex be true? Is she really not pregnant? They just think that she is because of a positive test. It's getting more likely. The presumably vaginal bleeding, though, is going against my previous diagnostic guesses of trichinella and vasculitis. That does fit more with an ectopic pregnancy, but they've already scanned and seen nothing. So the other thing it could be is a molar pregnancy. But if it was a molar pregnancy, then surely it would still just be abnormal cells, like if she had an ectopic, unless the molar pregnancy has become malignant. There is something called occult choriocarcinoma, where abnormal fetal cells become hidden, and that would cause a persistent positive test, even if they couldn't be seen on an ultrasound. It would usually take a more detailed test like a CT or MRI to diagnose, and could cause all of her symptoms in theory. Oh, that would work so well. All right, I'm going for occult choriocarcinoma as my third and final diagnostic guess of the living. For the other patient, it seems like Wilson is desperately trying to get House to drop the cause, but we know that he's subject to the most stubborn levels of persuasion resistance. So let's see how that goes.
Exoplanets. We can't actually see them.
Pregnancy test only infers an embryo's existence because of elevated HCG levels.
Which could also be caused by choriocarcinoma.
Occult choriocarcinoma, which is why we didn't see it on the ultrasound.
Tell all the alters that they have cancer.
I knew this would fall on deaf ears, but I just kept talking and talking.
Blah, 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 blah. Deaf ears, blah, 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 blah.
Whoa, before I celebrate my other diagnostic guess, did House just say deaf ears? The dad was saying earlier that the child has been substituting words for things like zebras, probably because he had hearing loss. Gradual hearing loss and kidney failure in somebody that's so young could mean Alport syndrome. It's like granulomatosis with polyangiitis in the sense that it affects the filtering membrane called the GBM, but rather than being acquired, it is genetic. That makes the kidney more prone to injury, which can cause rapid onset kidney failure. Oh, don't tell me that I could get 2 for 2 here. Let's see, I'm going for Alport syndrome as my second diagnostic guess for the second patient.
Ray? Ray?
I know what killed your son.
You don't get it, do you? I don't care what killed him.
It's called Alport syndrome. It's a genetic condition. Your father has the gene. So do you. You still pass the gene on to your children. He has high-frequency hearing impairment. And so did Drew. Now that we know what it is, he'll need treatment, but he'll live.
I miss him too.
She's responding well.
He saved 2 lives. I have to send him to prison. What would Cuddy have done?
10 clinic hours.
You've got 30.
Only Foreman can punish someone aggressively and with mercy all at once. Also 2 for 2. What? That has to be a new record. I have to admit, these reactions have been getting tough to keep doing while consistently missing them, but that has possibly given me enough juice to get to the finish line. 8.2 out of 10 entertainment, 8 out of 10 accuracy, 8.3 out of 10 diagnosis. This episode doesn't make full sense until you watch the previous one where a boy's clown ambitions get a kick in the nuts.